Good morning, guys. Today I'm going to be filming a day in my life as a fourth year medical student, and I'm on my way to the hospital right now, but I'm gonna be arriving there around 7:15, and I'm going to just take you through my whole day, hopefully film some stuff, if not in this camera, on my phone, and just share a little bit of my experience. Every day in this service, this is internal medicine, is really special. Like every day we have serious conversations, every day we make connections with the patients and the families. That's what I love, the variability or versatility of the specialty, but also the connections you get to make because you are there for this patient at their most vulnerable time, which is their hospitalization, right? And you still get to, you know, be the detective investigator. So I'm in my happy place right now. I'm really enjoying it. I'm 2 weeks out of 4 for the rotation. It's my audition rotation. So I'm supposed to be acting as an intern and taking half the amount of patients that interns take. So I'm trying to do just that while also, you know, working on my presentations and just trying to get a little bit better each day. The attendants that I'm working with are really smart and really good at bedside, so I'm learning a lot from them. And the attending that I'm working with right now prioritizes, you know, us teaching each other. So we'll look up topics and like discuss them after round, and that for me is really valuable. So yeah, I'm enjoying my experience and trying to get the most out of it. And I'll take you with me today to, you know, reflect a little bit more on what the day has to offer. Okay guys, I finished pre-charting and now I'm gonna go see my patients. So we just finished rounds and we had lunch and discussed the topics. I'm in the elevator. I'm gonna go up, finish up my notes, and yeah, just wait until the afternoon to get some admissions. So very interesting cases. What I'll do is that after I get out, I finish my notes, I will discuss further. But really effective and interesting rounds today. Hi guys, it's 4 p.m. and I just finished. They released me going home. This is the good thing about this service, like you finish a little bit earlier so that you can go home and like study. They give us a little bit of homework. So for today I'm looking at Legionnaire's disease and to present it tomorrow, and that will be my homework for today. But for the most part I can rest during the afternoon, which I'm pretty happy about. It leaves me, you know, rested for tomorrow, and every day it's interesting cases. So I'm gonna tell you a little bit more about what I saw today in a little bit. But yeah. Okay guys, I just got home. I'm a little tired. Usually like my body, it's early, but whenever like I'm getting closer to home, like I just feel this tiredness. So I'm going to try to not sleep, to not ruin my sleeping schedule, and do a little bit of yoga, a little bit of body movement, and you know, something easy because I'm not in the mood for something hard. But I do have some homework, as I mentioned in the previous click. I have to look up Legionnaire's disease because we think our patient might have that. He's presenting with signs of atypical pneumonia, like procalcitonin high, and some infiltration on chest X-ray, along with diarrhea. So we want to make sure it's not something like that. But he also has a history of heart failure with preserved ejection fraction. So it's kind of an interesting case that we're not sure what he got, or maybe he has multiple things going on, which could always be the case. So I like those cases that we get to be a detective and just waiting for further workup. I also had an admission right before I left that was presenting with shortness of breath, lymphadenopathy, chronic cough, worsening abdomen pain, and white phlegm in the sputum, and pulmonary nodules on previous CT done in another hospitalization. So with my pulmonary nodules and lymphadenopathy. So we're working him up for TB, cancer of course, so we're consulting hem-onc. Pulmonology is consulted as well. We're thinking it could also be some granulomatous disease. This is really interesting, you know. So cases that we don't know what's going on, but we hope it's the one that is more controlled, such as like sarcoidosis or something like that, instead of carcinomatosis, for example. But yeah, they're most likely gonna do like a lymph node biopsy to evaluate further, but we're waiting for that. So a lot of interesting cases. Of course, I always inform myself about the other cases that are not my patients, and it's been a really productive and effective rounds. We've been finishing by like 12, and that gives us a little bit of time, you know, to go to lunch, work on our notes, and then get ready for other admissions in the afternoon. So has been great. A lot of educational portions, you know, where the attending is teaching us, or he's asking, you know, we have a pharmacy team with us as well, so that's really helpful, because we get to ask like further questions on medication, what will work best, and, you know, investigate a little further on which medications, for example, for lady that was cardioverted for atrial fibrillation, we were looking into what's gonna be the best maintenance therapy for her. So we went over antiarrhythmics, the ones that we use for conversion to sinus rhythm, and the one we use for maintenance or maintenance. So that's interesting. You know, I really love the integration of pharmacy in our team, because it makes things much easier. They remind us of a lot of mistakes or things to, you know, look out for, side effects, and some of the times we don't pay attention as much. So yeah, we're thankful for our pharmacist. And yeah, today for the night I have to like look up that topic that I already told you, but also like edit another video that I have planned, and also do some logistic stuff like emails and things like that. So I'm hoping for a productive afternoon as well, but I'm gonna chill for a little bit, work out, prepare delicious dinner. That's my happy time, dinner time. I try to always prepare something yummy so that it motivates me to not fall asleep in the afternoon, because I usually, if I go to sleep like by 10 and I'm really sleepy, I usually sleep really well all my 7 hours or 8 hours. So yeah, that was today. I will continue to do other videos, you know, sharing my experience. Some days I start recording and I don't finish them, but I will try my best to, you know, record these little snippets of experiences that just show me how much I like this profession and this specialty and this field specifically. So for me and for you guys to see how it's like. I hope you enjoyed this video, and I hope to see you in the next one.